One of the concerns about any kind of surgery for our patients of color is that scar formation or keloid formation. Some people are more prone to keloid, and there's certain percentage of the population does form heavy scarring or keloids, which prevents them from having regular bunionectomy. Now, the Scarless bunionectomy helps to solve that condition. The Scarless bunionectomy via www.scarlessbunion.com will show you the procedure. This next upcoming case I'm about to show you is one of our patients. She's done very well, and you can see her scar, which is very minimal. Is the typical Scarless bunion incision, and this will show you the post-operative view of one foot. She's preparing to get the other foot done. So this shows the same right foot, pre-op, post-op. Now we're going to swing on to the patient, look at it clinically in case you forgot. This is the right foot after the lamb-modified bunionectomy. That's what it looks like. You just saw her x-rays. Okay, there's her scarring, and here's her scarring on the other side. She's looking really good. Again, this is the left foot that we're going to be doing in January. Okay, we're going to get it done. There's a young lady here. We have a bunion on the left foot. The right foot was done via the minimally invasive lamb method. Now, you see her scars right here, and that's about it. How was your experience with the surgery?
It was good. It healed quickly.
This was done in September. We are in the end of November right now. So you've healed up very well.
Mm-hmm.
It's only been 2 months since your surgery. So she's already thinking about the left foot. And we're going to take an x-ray today and go from there. The right foot was actually the worst of the two. So what you see here on the left is actually not bad compared to the right one. We chose to do this because darker skinned people tend to get keloids, and you know, and you get darker scars. But that's your scar. That's your scar. That's about it. And that's only going to get better. It's only been 2 months. And looking from top, there's no scar on top from the traditional bunionectomy. We're talking about the Scarless lamb-modified bunionectomy right here versus the traditional, which is a scar on top. Now we're going to be like this. Range of motion at 2 months is perfect. No stiffness.
No.
Are you happy you had it done?
I am.
We are ready for the other one. Are you ready?
I think so.
You think so? Let's get it done. Hey guys, another episode of talking about the lamb Peabody bunionectomy, minimally invasive / Scarless bunionectomy. Getting tremendous results with this, and I wouldn't do my bunionectomy any other way besides this for a true deformity. We're talking about from moderate to severe deformity. It's been doing great. It's starting to catch on now with people in my profession, and starting to get noticed. Results have been excellent, and 2 patients came in today. They're extremely happy. One had both feet done. The other one had one done, and she's ecstatic because you can't see the scar, and she's walking without pain. So take a look at the following and see what you think. Okay, well, this is a Scarless bunionectomy. I did it on both feet. You see it on both sides. This one was the scar for the Taylor's bunion. This side is the scar for the regular bunion. And this one is fresh, relatively new. Mm-hmm. This is the second side. Again, range of motion is perfect. Are you happy with the procedure?
Oh, yes, definitely.
If you had to do it again, would you?
Oh, for sure.
Okay. What was the greatest myth about bunion surgery before?
Just probably the pain, the amount of pain.
Is it painful?
No, it's not bad.
Not bad. So it's better than you expected, right?
Oh, absolutely.
Well, you had a bad bunion on this side. That's why we did this one first. And now it's nice and straight. And we went back and we did this one. Beautiful. So you're back in sneakers, I see.
Yes.
Good. Are you happy with the procedure overall?
Yes, definitely. This
is the lamb Scarless bunionectomy. Those are the scars. You can see how this one, the scar is all faded. And this one, you get a little bit of redness, but that's the incision site with the one suture before. And this is the pin site. It's going to match that foot very soon. So you won't see any scars. It's almost like you never had bunionectomy done by looking at your foot right here with the scars. So you healed excellent, my friend.
Great, thank you.
You're welcome. Okay, just got done with the surgery. It took about 4 minutes. We have the before right here, and we have the after right about here. So you can see the correction. This is the bunion before, nice little bump. this is the exact patient right after. Now we're going to take a look at the foot itself. Well, another successful bunionectomy. This is a bunion before, and this is a patient I did a few months ago, and where's her bunion? Her bunion is missing. Okay. Her scar, no more scarring. She just has a little bit of stiffness right here on this joint, but we're going to get that moving. But otherwise, are you happy with the look of the bunion?
I am, yes.
And the look of the scar?
There's really no scar at all.
9 weeks of the Peabody bunionectomy. We see there's your scar. There's your bunion. Hardly any swelling. We're talking about 9 weeks now. I guess pain for the first 3 days, as you would say.
Yes.
Otherwise, recovery was uneventful?
Yes, very much.
Okay. Was it better than expected, or?
Yeah, it was better than I expected.
Okay, cool. Nice. There you go. Foot looks good. Range of motion 9 weeks. No stiffness that we normally do with the scar bunionectomy on top. This is no limitation in range of motion. Looks really